Nurses and the multidisciplinary team must provide standard care for patients with stroke. This includes regular monitoring of the following: vital signs, specifically their blood pressure, physical activity, and level of consciousness. Additionally, nurses are required to provide a detailed patient counseling, education about stroke pathophysiology, and complete an assessment of the patient's needs. Preventive therapy is a primary prevention that aims to reduce the patient's mortality and morbidity rate from ischemic stroke. This therapy includes multidisciplinary care with managing risk factors and with health promotion. Aims of a health promotion include change to healthy diet, regular exercise, management of weight, restriction of alcohol consumption as well as smoking, and routine health assessments. Preventive drug therapy is the use of medications such as aspirin, an antiplatelet, or warfarin, an anticoagulant to prevent the development of an embolus or thrombus. Another drug that is effective for treating embolic strokes are statins such as rosuvastatin. Statins reduce lipid levels and decrease the risk of further strokes by stabilizing plaque in arterial walls. The removal of clots or emboli is vital for treating patients with stroke. The aim of surgical therapy is to achieve perfusion and to prevent any or further damage to the brain tissue and functioning. The safest and most effective surgical interventions are transluminal angioplasty and stenting. Transluminal angioplasty is an endovascular procedure that improves blood flow of the brain. A catheter containing a balloon is inserted through the femoral artery. It then travels to the stenotic artery, where it will expand and widen. Stenting is the intravascular placement of a stent device or mesh to maintain patency of the artery. Stents are inserted the same way as transluminal angioplasties. Stenting is an effective treatment for patients with ischemic stroke. For ongoing management, rehabilitation starts during the acute phase of strokes and continues after the patient has been stabilized for 12 to 48 hours. Health promotion should be continued by the nurse. The nurse must promote a healthy lifestyle and provide education to the patient and their family about stroke prevention. Lastly are assessments. Nurses and the multidisciplinary team need to conduct a primary assessment of the following. Also, a study nurse must complete a standardized 3-month telephone interview to assess the patient's functional outcomes.